It's been an amazing 2 days, but one that I do hope will set Nigeria on the path that it rightly belongs, a path of having good health outcomes. Rather than having a long speech, I would like to engage two advocates so that I introduce them properly. We all know Her Excellency Mrs. Toyin Saraki. Perhaps some of us might not know Honorable Ita Enang, but he plays a critical role. And I'm going to start with you, sir. I was asked to do this. You know, people say they don't want to hear speeches, that they want to hear you talk and let's have an interactive exchange. And I hope I'm not wrong. You are the liaison between the National Assembly and the Office of the President. All communications both ways passes through you. Am I correct, sir? I just need people to understand that. We had a very high-powered panel just before you came. And some of the things that came out of that panel, and several people in this room will agree, was that either at the state level or at the national level, our executive arms do not obey laws. You were once a lawmaker yourself. And now you're working as the interface between the parliament and the executive. First, is this acceptable in a democracy? If it's not, what can we do about it? And lastly, what role are you playing as someone who has been on both sides of the aisle? I can add a small one to that. As you answer your question, then situate the implementation of the National Health Act in all of this. Then we'll come back to you, madam.
Thank you very much. Let me appreciate the organizers of this forum and say that I apologize that yesterday I was called at a time I was still making a presentation at the Institute of Security Studies, and this morning I was billed to be here by about 11, and then I was still with the executive and the legislature where the Conference of Commonwealth Parliamentarians was being opened at the International Conference Center. So I apologize for arriving now. Let me say that I am Senator Ita Solomon Enang. I was in the House of Representatives for 12 years, and after that, I served in the Senate for 4 years, and immediately after, I'm appointed as the liaison officer between the presidency and the legislature, and in particular the Senate. Now, there is no question of the executive not obeying laws. It is that the public may have a wrong impression of the executive not obeying laws, or the legislature may also have a wrong impression. Take, for instance, if there is a resolution of the legislature asking the executive to do a thing, and obeying that resolution will amount to a breach of a law validly made by the legislature and assented to by the executive, which one will you obey? A resolution which urges you to to take action in a matter that will breach the Constitution. I think the executive will stand on the side of the Constitution and the law and will not obey that resolution so that it will not breach the Constitution. But the executive will not just say, look, who are you? Or I'm not going to do it. It will relate with the legislature to draw the attention to the legality, constitutionality, or otherwise of it. And then there will be amity. But when there is this amity, unfortunately, the public will not be aware. And and the parties sort out themselves. That is the executive and the legislature at the leadership levels. Now, please let me, before I get to the point of situating the implementation of the National Health Act or the Health Insurance Act. In all these legislations, I have been a party to making them because I spent 16 clear years in the National Assembly from 1999 to 2015, June, and from August, I became advisor. So I'm spending my 18th year on the Hill. Therefore, I have seen all. I have participated in all the trouble. I have participated in all the solutions. Now, before I get to this one, I want to say that there is an ongoing view that there is a very serious trouble or heat or discord between the executive and the legislature over certain matters. Is that correct? Is it the view of the public or is it the view of this audience that there is conflict between executive and the legislature? Is that correct? Okay, there is the audience here believes that there is no problem. There is. Okay, how many people say there is a problem? Okay, how many people say there is no problem? Okay, that's all right. My view as liaison officer and my view as an experienced participant on both sides is that there is no problem between the executive and the legislature in Nigeria, and there is no problem between the Senate and the acting president, no problem between the Senate and the presidency, no problem between the executive and the legislature. What is happening is simply legislative and executive democratic activism. Both sides are maintaining and observing the oath they took to defend, first, the Constitution, and two, secondly, to defend the independence of each arm of government. And when an arm of government, when the legislature takes its position to defend the legislative powers, that is not confronting the executive. When the executive is stating its position as to the Constitution, it is not confronting the legislature. And I want to say that in all this, the executive and the legislature meet at leadership levels and at all levels to sort out whatever the public feels is the issue. Now, coming back to the implementation of the Health Act and the National Health Insurance Act and other things as affect the executive, I want to say that the Minister of Health takes the lead in the health sector for the executive, and the legislature is led by the Senate President and the Speaker. And any officer in the executive which takes any action which is against what the legislature has directed by a validly made law, the executive reprimands that officer through the Honorable Minister of Health, the Minister and Minister of State. And I believe that in all that has happened in the health sector, where some parastatals and leaders of the parastatal have attempted or acted in a manner that is first against what the legislature believes is right, and second, against what the leadership of the executive, the ministerial leadership believes is right, the ministerial leadership has taken appropriate action to bring them back to the path of rectitude. I am aware that there are complaints about the National Health Insurance, I'm sure, and the implementation of the action of certain officers when somebody, the Director General or something of that institution was directed or asked not to do a thing, and the legislature said, look, you are not doing right, step aside, that he refused. But I believe that this audience, through the interactions yesterday and today, are aware that the ministerial leadership had taken action and decisions and resolutions which I believe is acceptable to the legislature has been arrived at. So the executive is on course in managing the health sector. Thank you very much at this stage.
Thank you very much, sir. Yes, please, just let me. drop it there. So, I'm still going to come back to you. I'll just go to Mrs. Saraki now. But the activism you described, can that activism be for the Nigerian woman, the Nigerian child who is in the rural area, who has real poor health outcomes? Can we have activism between both institutions where it is not so much about individuals, but it's about the people whose voices can't be heard in Abuja?
I say yes, because let me quote my friend and brother, Dr. Ike Ekweremadu. There is a quote he likes saying, "It is not about we and them. It is all about we and the entire people of Nigeria." He says it is not about the executive and the legislature. That the struggle we all make is not about the executive and the legislature. It is about the executive and the legislature as one, as government, for the advantage of the people. The activism that I'm talking about is not the kind of activism that we call in labor aluta continua. You know, it's not that kind of activism. It's the kind of each arm of government stating and sticking to its position. Now, when it gets to the effect it has on the rural populace, now, I want us to take that health is a matter on the concurrent list. The national and the state and the local government has its own roles to play. At the role of the federal, it is regulatory, and regulatory only to the extent that it affects the federal powers. It now goes to the state, the powers of the state houses of assembly. All of them there are very many institutions at that level. So the person you are talking about at the rural level is perhaps subject to the jurisdiction of the state and the local government. I want us to know that there is federalism in this country. Fantastic. And much of what we're talking about, when you talk of the rural poor, much of it legislatively is in the federal capital territory, because it is only in the federal capital territory that the National Assembly takes the role of its own state houses of assembly.
Fantastic.
Thank you very much.
In fact, from that point, I think this is a good segue to ask Mrs. Saraki what role she played in the Kwara Rural Community Health Scheme. And this is important because I also, perhaps you might inspire some of our parliamentarians there who perhaps can speak to the First Lady in their states as advocates to get things going. I would like you to come from that perspective.
Thank you very much, Dr. Okonola. First of all, good morning, and a very, very warm wishes from me to every single one of the right honorable speakers that are here today and to the honorable legislators that are here today. When I got the invitation that this was taking place, I was really, really happy. I wasn't actually happy because I was getting an invitation. I was happy first as a Nigerian citizen, and then I was happy as a woman and a mother and an advocate. And then I was overjoyed to be the wife of a legislator in the National Assembly that for once in the history of Nigeria had decided to be very frank, very open, very honest, and tackle the issue, not of universal health access, but of universal health coverage. And I say coverage because 2003, when I went with my husband, and that was the first time in my life that I had lived in a part of Nigeria that can be described as a mix of rural and urban. That was the first time I saw for myself what we call the masses. And I don't want you to think that I'm looking down on the masses, because I feel that every one of us is a member of the masses. And that was the first time that I saw that it didn't matter if a state government said they are giving free treatment in a hospital. If a woman did not have 350 naira to pay for her registration card, she could not get that free treatment. And I also saw, for instance, that if a woman was in labor and needed a cesarean and happened to arrive in a clinic at the time that light had gone and there was no generator, it was either, and this is according to the spending power of her husband, she could be taken to another clinic that had a generator either by wheelbarrow or by taxi or not at all, and die. And that was, for me, a crystallizing moment when, just as a wife, I began to pressurize my husband as a state governor that you have to find a way to make quality health affordable, accessible, and guaranteed for every single indigene of the state. And that is, I believe, what led the Kwara state government at that time to partner with the Farm Access and the Dutch Health Insurance Fund to actually not just make health accessible for citizens at under $2 per capita per year, and this is a comprehensive package of health, but actually at the same time to upgrade the facilities of the health facilities where this care was to be delivered, and to also upgrade the training and education of the health personnel. And I'm really grateful to God that I saw this in my lifetime, because I would go all over the world and I would see their best practice models, and I would be jumping up and down in my seat saying, you know, we too, we have our own best practice model. And health insurance packages all over the world typically exclude pregnant women. But my own input into the Kwara State Community Health Insurance Scheme was to ensure that antenatal and postnatal care and care for the under fives was not an exclusion, because normally they would exclude this in health insurance packages as a foreseen event. And normally health insurance, once something can be foreseen, it doesn't cover it. But I actually advocated that I will not come out to support this health insurance scheme unless it covers pregnancy and the under fives as standard. And I want to thank the Kwara state government, at that time under my husband, but continued under the current governor. I want to thank the successive speakers of Kwara State House of Assembly that allowed me to be able to push for Kwara State Safe Maternity Services Act, which actually gave a list of commodities that any facility where a woman is going to deliver takes place. And we know that if you actually improve facilities for delivery, which includes having a theater, it automatically improves community health, because the health of a woman is also the health of her partner and the health of her family. So what brings me here today? I will always advocate for the downstream. I know that people see me all over the world and they think she's an upstream person, but what I am interested in as a citizen of conscience is to take whatever you are doing here today to the every last mile and every last woman and child in Nigeria. Not just, you know, I think distinguished senators spoke about perception. To be very honest, when I hear people talking about perception, my eyes glaze over, because this is not about perception. If every woman in Nigeria knows that whether she is ill or her child is ill or her husband is ill, that she can walk into a health facility, whether it is a primary health facility, which is where I hope she would first present herself, or a secondary health facility, or a tertiary health facility, And that same 350 naira or 450 naira, instead of it being a one-time point of care expense for her, if at that point she can use that money to join a health insurance scheme, whether it is the national health insurance scheme or a private health insurance scheme, and that her care will be covered for 1 year at a quality that is accessible for her, affordable for her, with care delivered respectfully and with dignity, then I will support that. And that is the reason why I'm here today. I want to thank the Senate President. I want to thank the Speaker of the House of Representatives. I want to thank every single legislator here and every Speaker of the House of Assembly here. And I want to pray that in the lifetime of this administration, with full integration between the executive and the legislature, right down to the state executives and the state legislature, that you will all be able to put your hands on your hearts and say, we recognize the weaknesses of our health system. We recognize the unmet need to deliver the demographic dividend. And not only do we recognize it, we have tackled it head on, and we are going to deliver the solutions to our citizens. And then I think at that point, we will not need any communication experts to tell us about perception, because our people will show us their approval in their health. I want to thank you very much for allowing me to speak and to tell you that you have my support. Thank you.
Thank you. To be honest, ladies and gentlemen, how do you respond to such a passionate speech from the bottom of one's heart? That was very touching. I'd wanted us to have an interactive session, but I don't think there's any need for that anymore. Senator, thank you very much, sir. Your Excellency, thank you so much for your time. Your glasses.
Not mine.
Okay. Thank you very much. I appreciate it. Thank you. Thank you so much. Please, a round of applause once again for our guests. All right, so as we wind down this event, I've been told that there are prizes, just quick one, from Uneka, from Somto. Somto, what's the analytics from the tweets? If you've sent a tweet, you're going to get something shortly.
Okay, so let me just have a quick analytics of the tweet. I wouldn't take your time. Just a quick analytic of the tweet. So our tweets for the past 2 days endorsed 61,649 impressions. That means this is the amount of people we've been able to reach since yesterday. So to tell you that what we have been doing here has been able to get to about 6,000 individuals, both here in Nigeria and internationally. Can you take us to the NAS website? So this is a website that currently that we are tweeting from, and I'm going to encourage you, if you're not on Twitter, I can also help you to sign up on Twitter to also tweet at the NAS Assembly, and with the hashtag, the LegNet for UHC, LegNet for UHC NG. So that's the hashtag. Whenever you tweet it, every information, every picture, everything that has happened on this event since yesterday, you will have all the whole details on your Twitter platform. So I'll make myself available. I will help you to set up a Twitter platform on your phone, and then you can also follow JLN, like Neka said, and then follow other platforms like the NAS Assembly, which I said earlier. That will be the most platform we'll be tweeting about what we've been doing on the legislative network for universal health coverage. So these are the pictures, and these are all information and all the whole details, the quotes from this event, and practically every thing that we've been able to do this past 2 days. So I'm available to help you set up your Twitter account and also give you some on-hand steps on what to do and how to go about the whole Twitter thing. But the most important thing is to let you know that everybody, both here in Nigeria, both the young people, internationally, nationally, knew that something that the legislators are here and we are all clamoring for improved healthcare system for the country. Like I said, I'll be outside there, back there to help you set up your Twitter account and also tell you on how to go about it. Thank you so much. Any question? No. Thank you.
Okay, so before we go, or before we close, we need to close with a communique that's signed.
Which is the steering committee. We made mention earlier on, which you all agreed, that there should be a small steering committee that will provide leadership for the network. So we've drafted what should be the members of that committee, so we'll project it, and if it's okay by honorable members here, we'll just go with it. If you also have some amendments to make, we'll just amend. The second item that we're presenting will be the terms of reference that will guide the action of the subcommittee, so that we'll also go through them, and if it's okay, then we'll just read the communique and then we call it at the end. So we're waiting for Ani to present